today. My name is Cheryl Pederzoli. I am a marketing expert at ProSites, and I'm here to talk to you about 9 dental marketing tactics you can use to meet your practice goals. So we all know there's tons of different ways out there to do some marketing. A lot of these you're probably already engaged in. The challenge is really trying to figure out what's going to be effective for your practice. So what I've highlighted in green here are the ways that ProSites has found our dentists can be most effective in doing their marketing. ProSites has been in the online marketing world for about 13 years now, and we've worked with over 7,000 dentists. So we've got a lot of background on understanding what your challenges are and what can help to overcome those. But of course, the first thing you need to do before you can decide what tactics you want to use is to develop a plan. And a plan starts with a goal. So I put up the poll at the beginning asking what your primary goals were. Let me see if I can share these answers with you. Most people said it's finding more patients for the practice. And second most important is getting more out of your existing marketing. So these are the primary goals that we see from the doctors that we work with. Finding more patients, trying to sell higher value sales and services, or optimizing your existing marketing. And once you understand what your primary goal is, that's going to dictate what tactics you want to use. So if you're looking to get more patients, you're going to want to find tactics that are going to allow you to be there when patients are looking for you. So things like word of mouth, local search optimization, or paid search advertising. If your goal is trying to sell higher value sales and services, maybe you already have enough patients, so you're not really looking for more patients, but you need a better ROI in your practice. You're going to look to things that are going to engage your existing patient population, such as social media engagement, patient email marketing, or in-office marketing. Finally, if you're already spending a lot or you're doing a lot of marketing on your own, you want to make sure that what you're doing is optimized and you're getting the most return out of everything you do. So in that case, you're going to want to look to things like broadcasting your message and making sure you get it everywhere you possibly can, optimizing your website, and then making sure that you track ROI and make decisions about what your next marketing tactic should be based on what you're seeing today. So let's dig a little bit more into these. Now, the first starting point for anything is making sure you have a solid website. You wouldn't run a practice without a sign out front. Think of your website as your virtual sign on the internet. For those of you who rely on Yelp or Facebook pages, while those are important to have, they're not going to replace your website. Your website's really going to be that cornerstone of all your marketing. It's where you point all of your advertising and promotion. It's also what people see and know that you're a legitimate practice. I mean, nowadays everybody goes and checks out websites before they'll actually engage with a vendor. So having that good solid website is really important. Now, this point I can't stress enough to you. If there's nothing else you guys take out of this presentation, it's make sure your website is mobile friendly. This is super important for a couple reasons. One, right now Google has said more searches happen on a mobile device than on a desktop. So if you know people are out there looking, you want to make sure you give them that best experience. But second, Google is starting to prioritize the search results based on people having mobile friendly devices. So that means if you're not a mobile-friendly device, if you're not keeping up with that, you might actually see your rank drop when people are searching for dentists or providers in your area simply because you're not mobile-friendly. So it's really important to make sure you have a mobile-friendly site. So your goal is to get more patients. Let's explore a few strategies. First one is word-of-mouth marketing, basically having your patients spread the word for you. Now, it used to be that the only way you could do this was to ask your patients to tell a friend. And that still might work. You know, put up a sign in your practice. If you love us, tell a friend about it. Sometimes people will even offer incentives. You know, if you have a friend that comes in and says you referred them, maybe you'll get a discount or you'll get a special on something. But now in the age of social media, there are so many more things that you can do. Social media makes it a lot easier for people to tell people about you, but also answer the question. So I'll give you a real example. About 6 months ago, I was looking for a doctor. The first place I went was actually Facebook. I went and I asked my friends, I need a doctor in the area. Who do you guys recommend? And for me, because there's so many doctors in my area, I don't know who's out on review sites. I don't know, what one website versus the other is going to tell me about a doctor, but I do trust my friends. So that's one example of why social media is so important. And when people did give me the recommendations, they were actually able to tag practices right in there. So if they said, hey, go check out Dr. Smith's practice could actually come through. Dr. Smith's practice could look and see that somebody referred, my friend referred me to them. And not only could they track that this activity is happening, they could actually outreach to me directly and say, hey, we'd love to have you come in. Here's our phone number. Give us a call. We'll schedule an appointment. So social media is making it really easy for people to share the message, have your patients actually do your marketing, but for you also to track how well it's working and you to be able to do that follow-up. We've got a picture here, which is something that I totally love. We give out these social media signs when we go to trade shows. And I don't know if it's really clear, but one says floss like a boss, another one says love my smile. And we encourage our doctors to take these, and after they meet with a patient, have the patient hold them up, take a picture, post it on their social media channel. So in this case, it was Facebook. And towards the bottom of the page, if you can tell, the parent actually tagged another person in their family within the comment section. So not only did this doctor, put this message out there, but now all of a sudden everybody who is connected to these parents and this other family member, I'm assuming, also gets to see this picture. So social media has also made it easy to exponentially get a lot more people looking at your practice. Now, social media, and specifically what I've talked about right here, it's relatively low cost to get set up. Depending on how active, though, it could involve daily or weekly labor to try to keep this going and keep a consistent presence. Now, the next tactic I want to talk about is local search engine optimization. And sometimes you'll hear people separate these out to local search optimization or search engine optimization. I kind of lump them together because really what you're trying to do is optimize your website so you appear high on the list of results that are returned by search engines. You want to be found when patients are looking, but really you only care about being found in your local geographic area. So it's not like you're out there competing with 175,000 dentists. You're really just competing with those people who are in your local area. Now, why is this important? Most people will go out and search. They'll use Google, they'll use Bing, they'll try to search when they're looking for a new dentist. But they're not going to go past the first page. There's some statistic like 85% of people never go past the first page. So you want to make sure that you're within that top 10 listings that show up on that first page. If you're in a small area and there's only a handful of competing offices, might not be a big deal. You guys might all show up. But if you're in a larger area or you've got a lot more competing offices with you, it's really important to make sure you optimize. Now, the way you do this is to make sure you have content that matches what people are searching for. So if you want to be found when people are searching for teeth whitening in your area, you want to make sure you've got that type of content. It's very predominant on your website, and you also have your address information so that people know it's teeth whitening in Windsor or something like that. Another thing you can do is claim local listings. Now, these are going to be things like Google My Business. So if you search and that kind of listing of directory, these are the dentists right in the immediate search area, you want to make sure you have your information in there that's current, accurate, good phone numbers, good address. The other side is you can optimize the back end of your website. Now, this is something that most people never see. The metadata is it's tags that Google and search engines read that tell them a little bit more about what this site is all about. So there are optimizations you can do on that end too. Now, search engine optimization it takes a while to get going. It takes a while to work. I'll be completely honest about it. And it can be very labor intensive, but the payoff is huge. If you can start to show up as those top listings, you don't have to pay anything extra. You don't have to pay for advertising. It really does benefit you in the long run. It just takes a little while to start working. Now, the third tactic I want to talk about in relation to finding new patients is paid search advertising. These are those little ads that show up at the top of Google or Bing. It does indicate that they're ads, but it's a way for you to instantly be found. What you do is you go and you set up an account with Google. You put in some parameters that says, I want to be found for these specific keywords, and this is the amount that I'm willing to pay for it. You basically set up your ads, what does it say, and then bam, you can get these things turned on almost immediately. It's a quick way if you're trying to get some traffic in quickly. It allows you to ramp up or down. You can change your budgets on the fly. So, 1 week maybe you're good, you don't need any more people calling in. Another week you're really slow and you do. So you can ramp it and change it. You only pay if somebody clicks your ad. So if it shows 100 times but it only gets clicked twice, you only pay for those 2 clicks. Very easy to track the success. The analytics that you can get both through the Google AdWords program, but then also in other things like Google Analytics will tell you exactly how many people are coming to your site from these ads. It can be costly if you don't do it right. And a perfect example I can give to you of this is a lot of cases people will go and set up their ads, set up everything, and forget to include the geographic perimeters. So their ad may be showing in areas that no patient could possibly come to because it's 3 hours away or something like that. That's just an example of where if you're not setting it up right, if you're not really experienced at it, it's very easy to mess it up. Now, the cost can get high. It does require a little time, skill to set it up and maintain. But like I said, you can start to see traffic immediately from it. So that is the benefit, that you can do that. It's also something that a lot of people use when you're in a very busy area, and it's really hard to organically get yourself to the top of the list. This will ensure that. So I did talk about both optimization and advertising. I just kind of want to show you guys really quick what it looks like. So if you were to pull up Google results, you can see the top listings, both on the desktop and the mobile side. Those top ones are those ads. Those are where people pay to show up. Anything below that, where I've got the pink arrows, is showing you what's happened from natural search engine optimization. These are sites that Google has said, yes, these are definitely clearly dentists. People like these sites. They've got authority. I'm going to show these ones next. So just so you guys can see what the difference between those two is. Now, let's talk about some tactics if your goal is higher value sales and services. What does this really mean? It means you have enough patients, but you need to find a way to get more revenue out of them so you can be more profitable. Now, the key to this is really focusing on strategies that are going to encourage your patient engagement. So, first one, I talked before about social media. I'm bringing it back again. In this case, what you're really trying to do is use social media to continue the relationship that you have with people. So what you're going to want to do is make sure you have a good, strong social media page. So set up your Facebook page. Make sure it has accurate information. Put some pictures on it to make it a little bit more lively. Then put up signs in your office maybe that say, follow us on Facebook. Have your hygienist talk about it as they're in their meeting with their patients, or maybe they call out, hey, we put up this picture yesterday, it was this person's birthday, you should go check it out. You want them to talk about it and encourage people to get out there. Then you want to talk about all these additional services that you're trying to sell. Now maybe it's a water flosser that you want to tell people about. You can put it up there. Maybe it's just something new to your practice that you've never done before, but now it's a new procedure that you offer. So write about it. Make sure people know about it. The last point here is encouraging two-way dialogue. And this makes people nervous. I know it does. But social media is great. And this is one of the reasons why people like to follow you, because they'll get that two-way dialogue. So you're going to want people who are going to put comments on or ask you questions, and then you want to engage. You want to respond back and make sure that they know that you're a person there. You're somebody who's going to respond to them. If you do get negative comments, address them. Address them publicly as much as you're comfortable with. There's going to be some things that you don't want to address, but maybe it's, we're really sorry about that. This was an unusual day for our practice or something like that. The other thing you really need to know, though, is there are times when you have to pull that conversation off social media. So if somebody is asking for, I have a cracked tooth, what do I do? And they're trying to get actual treatment advice for you. What you really need to do is say, thank you for reaching out. Please call our office at this phone number. Or if you know who that person is, give them a call directly. But treatment conversations you definitely don't want to be having on social media, but you do want people to know that you're listening to them. So a simple little comment back that says, you know, thanks for reaching out, let's get in touch privately, more than appropriate. Now, social media, it's relatively low cost to get involved. Again, it involves daily, weekly labor depending on how involved you want to get. So the next tactic, patient engagement email marketing. This is really trying to engage your patients by sending out periodic marketing emails. And I call out marketing emails separate from appointment reminders or things like that because you want to, the whole point of all of these little techniques is to try to make sure your patients know what other services you offer. So if you're looking at trying to engage with marketing emails, when patients come in, ask them if you can get their email address, add them to your distribution list, and then try to set a standard. Maybe on a monthly basis, you want to try to send out one email. Maybe it's a newsletter where you can talk about dental health, technology, studies. Maybe it's, you know, we've got a special. It's May. Your grads are coming up, and maybe they're looking for teeth whitening, so we've got a teeth whitening special for new grads. You know, call out those things so that patients know that you offer all these other services. There's a really good chance they don't, and if they don't, they're going to go somewhere else for the things that you could be helping them with. Now, the cost is relatively low, and the work effort varies depending on what it is that you decide to use as part of your standard, whether it's a monthly, weekly, you know, every 2 months, every 3 months. That's really up to you. So the last technique about engaging your patients I wanted to talk about was in-office marketing. And this is really, you know, stick with some of those tried and true things. There are things that your patients are going to come in, see in your office, and know, hey, they sell this, they can help me with this, look at these great results. So if you're selling electronic toothbrushes or water flossers, make sure people can see it. Make sure they know that you're selling those. Put signs on the wall if you offer procedures. You know, sleep apnea is a perfect example. A lot of people don't realize that some dentists treat sleep apnea. Make sure you've got something out so people know. Brochures in your lobby. Before and after bulletin boards are very effective too. It's a great way for people to see what it is that you can really do and understand how you can help them. So most of these are all relatively low cost, but huge, huge impact on the patients and their understanding of what it is that you can do in trying to increase those sales. So the last set of goals. If your goal is really to optimize your marketing, it's because you're already doing a lot and you just want to make sure that you're successful and what you're doing is really paying off. So broadcast your message. Make sure you're doing multi-point touch. If you put an ad in the paper, make sure you include your URL. I still see this. I still see people putting advertisements in without a URL. There was an advertisement I was looking at a week ago, and I went and I tried to search for that practice, but the person's last name was really complicated, so it was an ad for sleep apnea, surprisingly enough. And I typed in sleep apnea. I typed in the city that this person was in. They didn't show up at all. They hadn't optimized for that site. I actually had to go back and start to search a little bit more deeper in order to find them. So it's just an example of making sure that you do everything you possibly can. Another great example is if you're sponsoring an event. You know, you might dish out $1,000 to help sponsor an event. You want to make sure you get everything out of it you can. So share it with people on Facebook and Twitter beforehand. Put a page on your website. So if somebody wants to go and check you out and check out what this event's about, they can do that. Feel free to email it out to patients. The other benefit of this is that if a potential patient goes out searching on that event, the fact that you've mentioned it means you might show up in the results that they see. Right there, you've got another avenue, a little bit more marketing that's gone out, very little effort on your own part. Next thing, optimizing your website for users. I talked previously about optimizing it for search. Now this is optimizing it for users. It's making sure when somebody comes to your site, they can see what it is that you do. They can get the information they need, and they can get it quickly. You also want to make sure that your site loads up quickly, because if people have to wait for, Flash or video files, they're going to drop. They're going to move on to the next site, or they're going to go back to the search page that brought them there. So you want to make sure that it's optimized for user experience. The other thing that's really important is using forms to capture information. Now, in most cases, you say, oh, it's a lot easier. I want them to just give me a phone call. I just put my phone number on and I'm done. Well, if you think about a patient who's looking for a dentist, in a lot of cases, they probably are looking after hours. I know if I were to look for somebody, it'd be about 8 o'clock at night, just because of how crazy my days are. 8 o'clock at night, I know I can't get through to anybody and make an appointment. But if there's a way for me to send a message to somebody and have them call me the next morning, I will do it. If I had to actually call them and remember to call them myself the next morning, there's a good chance I may forget all about it and move on. So using forms to capture and allowing you to do that follow-up as opposed to leaving it to the patient to do it is a way to make sure you capture more patients, more potential patients that you as a practice can really grow on. So cost of making sure your website's user-friendly is pretty low. You just want to make sure you're going in it and looking at it as a patient. But it is a very high impact. Now, the last tactic I'm talking about is not necessarily a marketing tactic, but it is going to be a way for you to determine what marketing tactics to continue with. And this is ROI tracking. And making sure that you're comparing the number of new patients and the dollar value of those patients and responses to what you spend on a specific marketing effort. So you want to make sure you track where your patients are coming from. If they call up on the phone and say, hey, I'm looking for a doctor, I'd like to make an appointment, ask them, how'd you learn about us? Just jot it down somewhere, even if it's an Excel spreadsheet that you start to use to capture that information. Same with forms on the web. Try to find out where they're coming from. There are systems that will actually collect and measure these responses. ProSites does offer something, but there's a lot of other systems out there too where it'll take that information in, it'll look at who you actually have coming in as patients in your appointment book and say, hey, this is where they came from. This is how I know this marketing effort is successful. And online, you can use Google Analytics. Same thing. Google Analytics will tell you what websites people came from, if they came from paid search versus organic, which means they just searched on dentists as opposed to you paying for the ad that brought them there. Now, this could be labor intensive depending on how you do it. If you're going the Excel spreadsheet model, there's going to be a lot of work involved in tracking it. If you find one of the programs that'll do it, it'll definitely speed things up a lot for you. But this is super important because if you're spending money today, you're spending money on a newspaper ad, a sponsorship, maybe you've put your brick in at a local ball field like I showed you up at the beginning slides. You want to make sure that this is actually paying off for you and you're doing things that are really going to bring you patients instead of just throwing money out and not having any clue if it's working. So I went through all of these goals. I went through the tactics. I went very quickly, but you're all probably wondering, okay, now what? So the next step is really to set your goal. What is it that you want? Do you want new patients, higher value sales and services, optimizing your marketing, or it could be anything else. Maybe you're trying to build up your brand reputation or preparing your practice to be sold. Maybe you're trying to replace your baby boomer population with Gen Xers. Once you determine that goal, then you want to select the strategies. And you have to really put a lot of thought behind this because selecting those strategies is really important. And as you can see from what I was talking through, the strategies change significantly depending on which goal you're going after. Try to start in a reasonable area, maybe 2 to 5 strategies. I wouldn't go overboard and overwhelm yourself because it'll just be hard to execute and track on it. Next, think about who your execution team is. Do you have somebody in your office who has a little bit of time who can do these types of things? Or is the tactics that you're choosing something that requires a little bit more skill where you might need to look outside for somebody? And then finally, measure results. Did it work? Did it not work? What do you need to change? And if you kind of follow the standard flow, you should be able to have a solid plan that you're happy with. We've got a couple resources available, and we'll send this information out to you. So you'll get the hyperlinks later on. But we've got a blog where we've got all kinds of articles about the tactics I talked about, plus a whole lot of other things. We've got other recorded webinars and ebooks you can refer to, and then we have our definitive guide to online marketing, which talks really in depth about some of the topics I hit on. So I want to thank you all for joining us. Like I said, we'll take any questions that you have at this point in time, and if we run out of time for your questions, we'll capture those and we'll get back to you afterwards. So thank you, and I will just sit here and see if any questions come through. So I do have a question here. How do I learn more about Google paid search? The easiest way to do that is if you actually go out and just search Google AdWords. There's a lot of resources out there, lots of places where you can get information. But that should bring you to the Google page. That'll tell you a little bit more about that, what's involved, how to get started, all of that information that you need. Okay. Well, I don't see any other questions. So if you guys do think of them, then you can definitely reach out to us. Anybody at ProSites would be happy to help you. And okay, actually, I just see a few more sneaking in here. So let's look at these ones. Somebody asked, can we review the presentation at a later date? We will be sending that presentation out to everybody via email with the email that you registered with. You should get that tomorrow. It'll also be going up on our resources section of our website, so you can always refer back to it there also. Another person's asking, what is ROI tracking? So return on investment. So that's understanding if I put $2,000 into putting an ad in the newspaper or an insert into a mailer, understanding how much return am I going to get on that? Do I get 5 new patients that are all valued at $250 each? If that's the case, then it turned out to be a successful tactic for me. But if I spend $2,000 and I only got $1,000 in revenue, then that's a tactic that I'm going to want to not do again, or see if I need to change. Maybe the messaging was wrong and I need to go back and change that message, or I picked the wrong publication to put it in. So it's knowing how much you spend and how much revenue you get back from it, and then using that information to make decisions moving forward. Okay, another question. Can you give some more information on metadata and sitemaps? I probably can't go too deep without actually pulling up the information and showing you what it looks like. But basically, it's information that's going to be hidden to most people. It's kind of, you have to get into source code in order to see what it looks like. And it tells Google information about you. One example is a page title. So if you look at your browser, if you ever notice in the top where your tabs are, you see those words there. That's actually part of the metadata that tells your browser what to show. It's not what's actually on your web page, but it's in your browser. Another example is it's the description of your page. When you search on Google and you get those results back, underneath the title in the search results, there's a little paragraph. That paragraph is actually the description that you can say that page is about. If you don't have one, Google will grab some information and display it. But in a lot of cases, you want to have your own description. You want to control that conversation. So you tell Google what this page is about through that description. So that's kind of what that metadata is. A sitemap is really just a presentation to Google of these are all the pages on my website. I want to make sure you know that they all exist. In some cases, people put them on their website. You might find at the bottom of a page a little link for a sitemap, and it'll look kind of like a tree of here's all of our pages. But then there's also another type of sitemap you can do that talks directly to Google and lets them know about what your pages are. Okay, let's see here. Sorry, I'm just sorting. So I need to get this window bigger for myself. How long do you suggest to wait to see if the marketing tactic you're doing is working? A lot of cases it's going to depend on the tactic itself. So if you're doing an email, you're usually going to get results on your email within 2 to 3 days. You'll know pretty quickly if it works or not. If it's something like a newspaper advertisement, same thing. You're probably looking at a shorter time period, maybe 2 to 3 days. Yeah, most people, they're going to read the paper, they're going to throw it away. But if you're doing something like, your search engine optimization, like I said, that could take 3 to 6 months for you to see results. So that one's going to be a little bit more long-term. If you're starting to try something like social media engagement, I would give it, a couple of months of getting out there and trying to be consistent to know if it's working or not, because that's also another thing where, yes, you can instantly see results, but it takes a while to build up a following, people who are going to be looking for you. So it really depends on the tactic itself. And I think if you wanted more information about any specific tactic, I would be happy to answer that. We could also have one of our internet marketing advisors talk to you a little bit more about that too. See, somebody is asking, how can I get someone in my office to be able to have access to Google AdWords without paying someone else to handle my Google AdWords account? It really depends on how the account was set up initially. So if you set up your account, you have that access, and it's very easy to go in and set up an account on your own. If you had somebody else outside who had set up that account, what you're going to need to do is ask them to add the person in your office as a user, and they can easily do that. You can have lots and lots of people accessing an account. Have them add your person as a user, and then that person should be able to go in and take a look. AdWords accounts can be managed internally by your own staff. They can be managed externally. There's no requirement that you have an outside consultant to do it. A lot of people, though, just find that it's challenging for that small office to do it on their own, so they look for outside help. I'm just sorting through these. Somebody is asking about setting up a special page on their website. I'm going to have somebody give them a call separately. Just let you know that that question was asked, and we will definitely get back to you on that one. How often should you change up your website? I've noticed we haven't had much traffic on our existing site. Is it okay to switch it up every year or keep it consistent? We have people who change their site all the time. You want to have some stability to your brand image and your brand look. I wouldn't recommend doing it too often, 6 months, maybe a year. But it's something that it's your option. It's easy to change if you're using the ProSites site designer. We just try to make it easy for people to change it up. If you do find, though, that like your website's not mobile friendly, then I would recommend changing it immediately, even if you've done it recently, because Google is recently, they rolled out the second round of this mobile friendly preference. So you really want to make sure you jump on that. And I hope I got everybody. I'll check all the questions when I get off, and if I haven't gotten anybody, I'll reach out to you directly. So I think we'll close it down. We've gone a little bit over our time limit. I want to thank you all for joining us today. This has been great, and if you have any more questions, definitely reach out to us. We are happy to answer anything. You've got the phone number right here. You've got an email here, and you will be getting a message from us tomorrow thanking you for joining with that link to the session, so you can always reply back to that message also if you think of questions. Thank you very much.